You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's zone. Dr. Berkson, thank you so much for joining me today.
I am really happy to be here with you, Peter. I've been looking forward to this.
So I want to talk about hormones because I know you have a tremendous background here, and you've been practicing for years, decades, helping women, helping men with hormonal issues. The first question I'd like to tackle is the one that I get asked the most, which is, I have a history of breast cancer in my family, or I have a personal history of breast cancer. My doctors have said estrogen is dangerous, progesterone or testosterone is dangerous because of that history. Could you address some of those fears, where they came from originally, and kind of what we now know and why that's not true?
Excellent. So I want to share with you how we can download this or Vulcan mind meld it in like a minute or two. Remember that? I'll just press my hand against your head and hope the audience will get it. I'm pressing my hands against your heads. So Medscape is a very conservative online medical journal, and it goes out to about 8 to 9 million providers around the world to tell you where hormones are at. About a month ago, not even that, there was an article that came out in Medscape saying, now that hormones are vindicated, nobody knows how to prescribe them. Let's get hormones straight. And that is exactly what's going on. And they even had about a week before that, which we're talking September 2024, they had an article saying, why should women in their 80s and plus, meaning older than 80s, miss out on hormones? It's cruel. It's a disservice to them, but nobody knows how to prescribe them. That's the most conservative medical journal confirming what we now know to be true, that hormones really help you stay younger longer, often avoiding high blood pressure meds, meds for prediabetes or diabetes, multiple issues, even cognition. In fact, many of us in the hormone space feel that if you're on hormones, 80 to 90% of people would not end up with Alzheimer's disease. So why has there been this fear, and why did Medscape have this title, Hormones Are Back, but nobody knows how to prescribe them? Hormones were the most prescribed medication in the United States all the way up till the year 2001. And that's because they began in England in the 1950s with the promise by a gynecologist, by Dr. Wilson, that if you were on hormones, you could stay feminine forever. Because you're kind of extending your premenopausal life by taking hormones that you don't make, but that are exactly like what your body used to make, and you can put them into your system, and you can slow down the Mack truck of time. Well, we're an aging nation, and understandably enough, the government wanted to figure out how not to topple Medicare. So in the mid-1900s, and they launched it in the beginning of 2000s, they began a series of studies by 40 of our most prestigious institutions, although I won't say they really earned that title anymore. But Harvard was at the top, and our National Institute of Health, and they looked at women and said, how can we caretake women so we won't run out of money in the government when people are older? And one of the first things they wanted to look at was hormones. So they ran 2 randomized trials. They ran many trials, but they ran 2 randomized trials on hormones, and it looked like in the beginning of those trials that, oh my God, hormones actually caused the very things that we'd been proclaiming that they helped: heart disease, blood clots, breast cancer, etc. So we are a very reactive country. And the minute one thing happens, we switch to that. Another thing happens, we switch to that. When really in practice, seasoned doctors like yourself and myself and our colleagues look at what's been working clinically in practice. We call that clinical acumen. So since hormones were started in the 1950s in England, and then America was supplying them or prescribing them to almost 20 million women by the year 2000, clinically, hormones were working. You could go on hormones even after you had a stint, after you had a heart attack, after you had a stroke of all things. You could go on hormones when you were in perimenopause, menopause, and clinically we saw that patients not only looked better, but they fared better. With these 2 randomized trials, it looked like, oh my God, that's not true. And within a short period of time, biggies in the gynecologic terrain, like Leon Spiroff, he's considered the father of obstetrics and gynecology. And he was a professor at the University of Portland when I actually was going to Western States in Portland. Within a few months, he was looking at the data and he said, don't look at this data. It doesn't match with what we've seen in practice, and things are wrong with the methodology of these studies. So very soon, reanalyses of these studies started coming out showing that they were done wrong. They had terrible mistakes. But because we are a reactive nation in the United States, within the very first few months that it looked like hormones were bad, but that was an erroneous conclusion, lawyers got in on it because we're litigious. And associations warned their physicians, don't write scripts for hormones. You might lose your license. You might get sued. So gynecologists in the United States got very frightened of writing scripts for hormones. The rest of the world didn't act so reactively as we did. And we are so incredibly reactive that we stopped teaching hormones in medical schools, in osteopathic schools, and even, sad, in naturopathic schools. So suddenly we have 2 decades of no providers, medical doctors, nurse practitioners, naturopaths, physician's assistants, no providers being trained in hormones at all. There's no curriculum. In fact, there was a survey in 2023 of gynecologists. You would think a gynecologist knows hormones.
You would think.
You would think a urologist, that's a male doctor, knows hormones. But they did this major study. In fact, this was just presented to Congress because they're trying to take our tax dollars to try and find people to teach hormones now to med school students because there are no doctors that even know how to teach it. So what happened was there was this survey in 2023. They questioned gynecologists, how many of you have actually had a course on hormones? And 31% said they'd had one course of about 6 months and it wasn't extensive in hormones, which means 70%, the majority of gynecologists, have no training in hormones. So they stopped training doctors. In fact, David Brownstein, a mutual colleague of ours, his 2 daughters just graduated osteopathic school and residency in the last 2 years. And I asked them, I said, how was your training in hormones? What did they say? They said, we got no training in hormones. They cause cancer. Don't write scripts for them. End of story. And this is in the last few years.
And to be clear, because hormones is a big word.
Oh, sorry.
No, that's okay. I just want the audience to be clear.
Right.
We're talking about estrogen, testosterone, progesterone. Are those the 3 main ones that we're talking about? What are we talking about? Because plenty of people are on thyroid hormone. Right, and plenty of people are on prednisone as a hormone, but which ones are we specifically?
Great question. I probably should have started there with Hormones 101. I apologize. First, let me get hormones straight. Hormones are the most powerful signaling molecules in your body because they're the only molecules in your body that can directly speak to genes. And they tell your genes, which have all your archival information of your parents, your grandparents, your great-grandparents. It's your human genetic library. And hormones speak to that library, pull out the right information, and tell your cells what to do. And the reason vitamin D is so famous today is that it's a vitamin, which means we have to make it, and we have to take it regularly because our bodies don't make it, but it's also a hormone. So hormones are the most powerful signaling molecule that are not just sexy things or reproductive things. They literally speak to genes, not designer Levi genes, but genes to tell your body what to do or your local tissues what to do. And they speak to genes in your brain, in your eyes, in your vocal cords, in your lungs, in your liver, throughout your entire digestive tract, on your bones, on your muscles, on the cells that line your blood vessels. Hormones deliver signals to all of these. So you would think if you're a gastroenterologist, a gut doctor, you'd learn gut stuff, but then you'd learn hormones because hormones totally line the gut to help keep the gut healthy. But no, gastroenterologists don't learn hormones. Your brain, the piggy bank of your memories, your hippocampus, the neuroplasticity that helps you make decisions or have gut feelings, all run by hormones. So you might think that, well, maybe neurologists and gerontologists would know about hormones, but everything's compartmentalized there's such a vast body of information in medicine that things are compartmentalized. So we've got eye doctors, gut doctors, cognition doctors, joint doctors, kidney doctors, liver doctors, and they all do their thing, but all those tissues are really run by hormones. But they don't learn that part of it. It's really crazy. So nobody has been given, there's no board certification in menopause medicine. There is no board certification in andropause medicine. And the awful thing is that because our planet is dirty and encompassed with pollution and chemicals that actually can harm our own hormones, we are now having 13, 14, 15, 16, 17-year-old kids that don't have enough hormones. And we are now seeing erectile dysfunctionality and anxiety and sleep disorder and bone in issues like osteopenia and not quite osteoporosis, but in teenagers, because hormones run everything in all phases of life, but nobody's trained to assess any of this. And thus I really appreciate the opportunity to come here and talk about it. So hormones are important. They run the show. They run the north to the south. They run sexuality and reproduction, but much, much, much more than that. But because of the Women's Health Initiative in 2002, everyone got nervous about hormones inappropriately and wrongly. So doctors stopped being trained in hormones. So if a doctor doesn't know hormones, and you come in as a patient and ask, hey doc, am I a candidate for hormones? You're usually going to get a wrong answer, a negative answer, because it's human to be down on what you're not up on. So they're not trained, and all they've heard is it's bad, 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 and scary, wrongly. And so people have been asking their doctors if they can take hormones, and their doctors basically say they drive cancer, they're not worth it, you're a high-risk person, maybe you're not even a high-risk person, you still shouldn't take them. Well, in 2019, there were many reanalyses of this wrong first Women's Health Initiative that came out in July 2002. But in 2019, after 14 analyses that all showed that hormones were protective on breast tissue against breast cancer, estrogen protected against breast cancer, the original researchers, which include Harvard on down, They reanalyzed the Women's Health Initiative and said, we made a terrible mistake. Hormones, if you're on estrogen and you're healthy, for an average of 5 years, you have a 23% less risk of getting breast cancer in the first place. And if you're on hormones and you get breast cancer, instead of suing your doctor, you should shake their hand. Because if you're on hormones, this is exactly the same for men. If men are on testosterone and they get prostate cancer, if women are on estrogen and they get breast cancer, they have a better acting tumor and they have a decreased risk of dying from the disease. That means that the 2019 reanalysis of the Women's Health Initiative, by the very authors who first put it out and first said, stop it, we think it's dangerous, said, we have egg on our face, we were totally wrong. And if you're on estrogen for an average of 5 years, you have a 44% decreased risk if you get breast cancer of dying from it. Almost a 50% reduction in fatality. Nothing has ever been proven that successful. But that message that estrogen was safe, breast protective, and if you're on estrogen and you get breast cancer, you die less from it, more than anything else has ever shown. That didn't make headline news like the headline news in 2002 because we're a reactive country. We're a litigious country. We want to get somebody and, like now where the whole country's taken over by semi-glutides and we get onto something and we just go, choose my expression, can I say this, balls to the walls about something, and we make it, we're kind of crazy. And that's what Leon Spiroff, he wrote many articles saying, don't throw the hormonal baby out with the bathwater. Women on hormones think better longer, project vocally better longer, have less kidney disease, have less lung disease. So what exactly are the hormones? And I hope I'm not talking too much, but it's testosterone, estrogen, progesterone, DHEA, which is dehydroepiandrosterone, and pregnenolone, and also oxytocin. And all of these hormones are in both men and women, so everything I'm saying applies to our wonderful gents and our wonderful gals who shouldn't be missing out on this. I had breast cancer almost 33 years ago, and I've been on hormone replacement for almost 30 years, and in a month and a half I'm going to be 76, and I'm still running around the country with a fire in my belly because I don't want other people to miss out because I didn't. And everyone's always saying, how do you have the energy and the brain, the lubed brain and so forth that you have? Because most people my age don't get to enjoy that.
I want to go back to get a point of clarity from you.
Okay.
Many women have been told they have estrogen positive cancers. So two things there. Number one, do they have estrogen positive cancers that are caused by estrogen, or do they have cancers that are caused by synthetic estrogens from chemicals in the environment? You mentioned chemicals earlier, so BPA, plastics, cosmetics, pesticides, all have endocrine disrupting potential to behave like estrogen. Mold toxins have endocrine disrupting behaviors to act like estrogen. So what is it, in your opinion, that when somebody has this diagnosis of an estrogen positive cancer, do those women need to fear estrogen, or is there a deeper story?
Great question. That's what women always say. I had an ER positive breast cancer. Is my tumor fueled by estrogen, so I can never be on estrogen again? And what do we do with breast cancer patients? We give them estrogen blockers. But in actuality, tamoxifen, which is a major estrogen blocker, has been shown to be helpful in triple negative breast cancer, which has no estrogen receptors, no progesterone receptors, no HER2/neu receptors. And why? We think that tamoxifen actually reduces inflammation, reduces stem cell activity. So there is two lines of debate and theory of what causes cancer. There are those that say it's caused by cancer stem cells, breast cancer stem cells. They don't have receptors for hormones. If you take hormones, they're not, your tumor isn't encouraged to grow more. They're caused by cancer stem cells. And in fact, there is a book out that I urge everyone to get called Estrogen Matters by Avram Blooming, who is an oncologist in Southern California. And he was the oncologist who helped guide the way breast cancer patients are treated. In the olden days, if you had breast cancer, we didn't know how to treat it, so women had disfiguring, disabling, huge, almost whole body surgical intervention. So they would have big parts of their torso removed, thinking to try and save their life. Everyone's got good intentions. It's not like people do things really out of meanness or cruelty. But in the olden days, women were treated excessively until Avram Blooming came along and said, hey, we could be much more conservative in care. We can do a lumpectomy and radiation. We can do mix and match. We don't have to take so much of the body away to save a person. And he was able to prove, he had to work with the NIH, he had to initiate studies, he had to retrain surgeons and radiologists. He spent a lot of time changing the paradigm of thought. So instead of getting the disabling surgeries, women can now have different options for more conservative care. He was that guy. He worked with a few other labs. It wasn't only him. He's back. He now is saying, we have made a mistake on estrogen. Estrogen is basically driven by cancer stem cells. It's not driven by estrogen or progesterone. The other theory of thought, so two theories of what initiates cancer. One is breast cancer stem cells. Everybody says it's DNA damage that hits it off, but what's causing that DNA damage? One says abnormal breast cancer stem cells are causing that abnormal DNA damage. And the other thought, which gets everyone in a sticky wicket, is that estrogen fuels breast cancer. And it's sitting right next to that DNA. It's got a parking space right next to it. It's causing this. So this is the theory of a lot of doctors and surgeons today. And on my website, drlindseyberkson.com, I put a group of doctors together to debate, does estrogen cause breast cancer or not? And it's for free on my website called Everything Estrogen. If you go to my first page, drlindseyberkson.com, and I'll give you how it's written. You just scroll down the first page. It's right there for you to listen to. So Avram Blooming has been telling doctors the reason the thought that estrogen fuels and drives breast cancer is wrong in the majority of cases. Nothing's 100% in medicine. In the majority of cases, is that it's not, let me backtrack with this because I want to make it simplistic to Vulcan mind meld it. So when they take a tumor out of a woman, they look to see if there are estrogen receptors, progesterone receptors, and HER2/neu receptors, and the percentage of receptors gives you an idea of the condition of that cancer. So they say if you've got 90% estrogen and 90% progesterone, you can't take estrogen and progesterone because it would dock into those receptors. Avram Blooming says, no, all healthy breast cells have estrogen receptors, progesterone receptors, and HER2/neu receptors. That's a healthy breast cell, a ductal cell. It's got those because that's how they speak and have chit-chats with estrogen. Estrogen docks on those receptors, literally parks like a parking space into those receptors and delivers the genetic information to keep breast tissue safe. So Avram Blooming says, actually, if you have ER positive, PR positive, that's because your cancer hasn't overtaken the health of a regular cell, which has these receptors. All breast cells have these receptors. So if you take hormones, you're not fueling something, you actually have archival remnant of a healthy cell, and that's why triple negative is such a more challenging cancer to treat, because it's lost all of its original cell health and now the cancer has completely taken over that cell, so there's no more receptors. They call it triple negative. No receptor for one hormone, the second hormone, the third, so it's triple negative, and it's a harder cancer to deal with. So there's two different opinions. Breast cancer stem cells are what drive breast cancer, and hormones have nothing to do with it. And hormones drive breast cancer, and you really should avoid them. So what we should do is look at the science. So before the Women's Health Initiative, and up a little bit overlapping with the time when it first was published in July, when it was prematurely stopped in July of 22, there were 26 studies where people wanted to know, can a woman with breast cancer take estrogen and will be safe or not? And most of these studies were run at prestigious institutions. We're here in Houston. One was run at MD Anderson. One was run at the University of Wisconsin. One was run at the University of Georgia. They went from 36 years in length to some of them were a little shorter, but the average was about 10, 15 years. And they would take a woman who just had ER-positive breast cancer and give her some estrogen. And then they would compare this group of women to a group of women with similar tumor size, similar age, similar height and weight. So we call those matched cohorts. And they would track and see women who had ER-positive breast cancer, how did they do with no hormones? And women with ER-positive breast cancer, how did they do with hormones? And in every single study, nobody did worse. And in the majority of studies, women with ER-positive breast cancer had less recurrence, less death if they did have recurrence. There is a complete theme in all the research on this, which is exactly what the reanalysis of the Women's Health Initiative showed. Decreased recurrence if you were on hormones, decreased death if you did get breast cancer. And not one study showed worse, and the women on estrogen had much higher quality of life. They could sleep better. They didn't get brain fog. They didn't gain mid-torso weight. They had more muscle response to workout. They had stronger bones. They didn't have to go on osteoporotic medications. They did a lot better. So the problem is the doctors we have in practice right now were the doctors who were told that hormones drive cancer. Now, there still is these two different theories, so not everybody is totally agreeing that they don't, but we have a lot of research run by prestigious institutions, if that's what you want. And some we don't have randomized studies with estrogen with breast cancer, but there are papers coming out from people like Hudis and people who've been in the field a long time saying it's cruel and it's a disservice to deny women hormones. We have not seen that estrogen ups the risk of breast cancer in typical women, and we're not even seeing it in breast cancer women. But when we put on Let's Talk Estrogen, a number of the physicians we invited said, well, I now believe that you can give testosterone to breast cancer women, but not estrogen. Estrogen drives breast cancer. So one of them in particular was a surgeon who then became a breast cancer specialist. So I sent her these 26 studies, no response. And that's the deal when you get information that's different than the way you've been thinking, you get this cognitive dissonance of no response. So we work now with a lot of women who have breast cancer, and every case is individual and a little bit different, but we like to be able to give hormone replacement as well as other things, but we don't do any of it without the transparency and the agreement of the oncologist, because you get into too much litigious snafu and too many problems, and you really want everybody on board. So I spend part of my time with the patients I treat. I don't charge anything for it. I talk to the oncologists. I send them all this information. I send them everything estrogen that's on the first page of my website, and I chat with them and answer their questions. And I'll tell you one patient's history in particular, but it's with ovarian cancer, and I think it's very, very illustrative. So I had this nurse practitioner, wonderful woman. She's in her mid-50s, and she's had 5 cancers. She had ovarian cancer stage 1. They treated it. She got it back the next year, still stage 1. They treated it. She got it back the next year, still stage 1, thank God. Then she got then they put her on immunotherapy, and she developed malignant melanoma, and then the next year she got ovarian cancer back a 4th time. So she came to see me, and I said, let's put you on hormones. Because progesterone is very, very anti-hormone, anti-tumor hormone too. Testosterone is extremely breast and immune system protective. So she was in Minnesota near the Mayo Clinic seeing an oncologist at the Mayo Clinic who was kind enough to get on the phone with me. And I said, look, you've got a patient with recurrent cancers. Here's the research I'm talking about. Can we work together, and can we put her on hormones for a few years and see how it goes? And this oncologist was I found that most of the docs I talked to from the Mayo Clinic are really, really cool. And they agreed. And she's now going into her 6th year of no cancer at all since we put her on estrogen, progesterone, testosterone, and oxytocin. I actually wanted to put her on one more hormone that she couldn't get in Minnesota. It's really hard to get, that I've been on for about 20 years. But she is now one of my most avid students. In fact, I came here to lecture in Sugar Land, and she's going to be here now, this nurse practitioner, and that's an extraordinary story. And we have a lot of patients that had breast cancer, went on aromatase inhibitors, another way of blocking estrogen, and now they have such severe neuropathy and tremors, and they have no brain, they can't even walk, they can't even think, they're absolutely in pain, no libido, forget that, no sex, they're dried up everywhere. And thinking of this one woman in particular, she came in and just cried and sobbed because she didn't feel like she could live anymore. So I talked to her oncologist and said, do you mind if we begin this program? This is what we're doing. This is the research. And the oncologist, now sometimes oncologists say flat no, and one time one hung up on me. So I'm not saying they're all amenable, but the majority of them are, especially with patients who say, I can't live like this anymore. It's terrible. And so we put this patient on hormones, and within a few days, her neuropathy started to improve. We did a few other things, and now a year later, she has no neuropathy, no essential tremor, and she hasn't had any recurrence, and she's doing better. But mind you, if she were to have a recurrence, what the statistics have clearly shown is that she has a decreased risk of fatality, of dying from the recurrence if she does get one. And that is so clear-cut in the literature, it's a shame that women miss out.
I want to back up again.
Please do.
That was great. I want to get your opinion on endocrine mimicking chemicals. And because you said there's 2 theories that are generally widely accepted, right? One is that there's the stem cell creating the cancer. The other is that it's the estrogen. So where do these other chemicals come into play? Because to me, there's plenty of evidence that shows the chemical soup we're swimming in contributes to DNA mutations and the potential for cancer lines to develop. So what are you seeing?
You are so smart, and you ask such great, concise questions. I appreciate that. So I wrote one of the very first books on endocrine disruption. I have 21 books out, and this was, I don't know which number book this was, but it was published in 2000 by McGraw-Hill, and it was called Hormone Deception. There were 3 books that came out introducing to the public the concept of endocrine disruptors. Up until 2000, really nobody had heard about it. When I sent it in to other publishers through my agent, a lot of people said this is only worthy of a magazine article. Nobody knew what the heck it was. They didn't think it was worthy of a book. So 3 books came out, Our Stolen Future, Hormonal Chaos, and my book, Hormone Deception. And based on that book, I was invited to be a distinguished hormone scholar at an estrogen think tank with the scientists who developed the theory of endocrine disruption. So I've been thigh deep in alligator land of endocrine disruption since the early 1990s when I started. That book took me 6 years to write. There was no information, no articles you could read. There was nothing written on it. I just had to go to scientific symposiums, at least 15 to 20 a year for several years and interview all the scientists. And when I worked at Tulane, I worked with the scientists who discovered the first hormone receptors. And in fact, our last few conferences were called Hormone. So I've been in hormone land for a really long time. And so even though I'm a chiropractor and a scientist and a nutritionist, I've ended up having my career be thigh deep in hormones. And then, of course, I learned the reason I had breast cancer was that my mother had been given the very first model of how we understand endocrine disruptors. What does that mean, endocrine disruptors? It means a chemical that can disrupt your endocrine system is your hormones. So chemicals that could futz with your hormones. And so my mother was given diethylstilbestrol. The acronym is DES. When she was pregnant with me, I didn't learn any of this till I was writing Hormone Deception and discovered I was a victim of the very book I was writing and the phenomena I was writing. While I was writing the book, I got breast cancer, and I'd been eating organically and detoxing and been a yoga teacher, lived in India, and I started getting multiple cancers. The breast cancer wasn't the only cancer I got. So I started writing Hormone Deception, discovered that diethylstilbestrol, that was the first most powerful endocrine disruptor invented in the world. It was 50 times more powerful than our own estrogen, and daughters born to the women given enough of that in the first trimester all got breast cancer, all at the same age, all had endometriosis, adenomyosis, multiple issues, and now even some of the granddaughters are getting ovarian cancer and breast cancer in their teens. And the men born to those women had a higher incidence of earlier onset prostate cancer and other malformations of their penis and so forth. So we knew that about endocrine disruption from 78 million pregnant women being given it from 1938 to 1971, when it was banned as the most cancer-causing substance ever invented. And it was put in feedlots in Chicago. I'm from Chicago. Were lots of feedlots because it makes meat taste really delicious, and a lot of farmers still illegally use it because it makes meat taste so delicious. And it was put in 365 prenatal vitamins because at that time they thought it was going to make a normal pregnancy even super, and a super pregnancy, and make it better. But apparently, right when they first were pumping it out, they had proof that it caused cancer in rodent models, and they hid it. And so the shit hit the fan many years later so I'm the last living DES offspring my age exposed to that DES in the womb. And the scientists I worked with at Tulane were the people that figured all this out. So I wrote a book on it. Then based on that book, I got invited to be a distinguished scholar. And then I ended up working with all these scientists that it was extraordinary, the interactions that we've all been able to realize. So these scientists said our planet is encased in endocrine disrupting chemicals, and herein lies the problem. Hormones are the most powerful signaling molecules in the body. They rule the north to the south. Endocrine disrupting compounds are now in egg, sperm, placenta, mother's milk. So by the time babies are born, we're looking at endocrine disruptors being a contributing factor to ADHD, to autism, to violent behavior, to cognitive decline, to reduced IQ, things that you would not want to have happen to your child, so you'd want to detox and learn how to reduce your exposure prior to getting pregnant, or even gentle detoxes during pregnancy because it's so important. So endocrine disruptors are chemicals that can futz with your own hormones, and we can be exposed all throughout our life, but the biggest deal is when you are a forming fetus and a brand new baby. So where do we get these? You stand under a shower filter. There's many in the water because our water treatment services don't remove metabolites of birth control pills or of hormone replacement or of other pharmaceuticals. We also get them in plastics, in even brushing your teeth with a toothbrush with plastic bristles. We have plastic everywhere. I mean, it's washing clothes that are inexpensive. Many new clothes have plastics in them, and then we rinse that out into the wastewater. So microplastics are estrogenic, and they are endocrine disruptors. Metals are very endocrine disrupting, so lead, cadmium, mercury, and the fish is now all contaminated with heavy metals. It used to be a great food, a perfect food, and now it can be an endocrine disrupting food. But through the work of Bruce Blumberg at the University of California in Irvine, he was able to show that exposure to endocrine disruptors is also making us fat and not able to lose weight no matter what we do, and maybe we need a semaglutide because we've got endocrine disruptors. So he came up with the term that some endocrine disruptors act as obesogens, where they actually make your fat cells worse. How? By altering fat stem cells. So he was the first scientist to show, and I've got a podcast interviewing him, but he's a very somber guy. He's a scientist, so it's not a light and easy that one conversation. Yeah. But he wrote a book called Obesogens, and it's the understanding of how chemicals futz with our stem cells. And the other theory of breast cancer is breast cancer stem cells, and the other one is estrogen, which we don't believe that estrogen. And why would Mother Nature make the hormones that drive humanity and evolution of humanity and birth? Why would she make those he make those hormones to be cancer causing? And if they were, we'd see more cancer when you're younger, not when you're older.
Yeah, because you're making more hormones when you're younger.
Exactly. Yeah. And the one other thing is that pregnancy is a time when a woman has so much hormones in her body, more than ever, and pregnancy after the first year is protective against breast cancer. So if hormones were actually causing cancer, then the more kids you had, the more risk you'd have of breast cancer, when it's actually the opposite. It's nuns that have the highest incidence of breast cancer because they never get pregnant, or most of them never. You mean?
Right. What do you think, going back to endocrine disruption and estrogen mimicking chemicals, we have, I would argue, one of the greatest confusions sexually that I've ever seen in my life. We've got, an onslaught of transgender surgeries. We've got people that are very sexually confused. Do you think that all of this exposure is affecting, their sexual maturation and development?
I am so happy that you asked this question, and I hope I'm not giving too much information. I've been writing, living, breathing, and experiencing hormones now for so long, and have such a passion about sharing the true science, because everybody says I have the science, and everybody's stance on science is disagreeing with each other. But so I'm hoping I'm saying these things in a way that can be understood. And now I want to tackle what we refer to as gender bending. So when I was at Tulane, and the name of the group, which was head by John McLaughlin, who was an amazing estrogen scientist, was called the Center for Bioenvironmental Research, but it was an estrogen environmental scientific community. And the main question that we asked and discussed for years was, is gender bending coming down the road because of endocrine disruptors? And it was based on the work of two scientists. One of them is called Tyrone Hayes. He's an integrative biologist from Berkeley. He's an amazing guy. And he was hired by the atrazine companies to do deep scientific dives over his labs at Berkeley to kind of enhance the weed-killing action of atrazine. And what he started to notice is if he exposed pregnant frogs to atrazine at the level that the EPA has a standard, and it was below that. So EPA says humans shouldn't get this level or more. He gave the frogs a little bit under that level. And lo and behold, the male frogs came out homosexual. And lo and behold, the male frogs had eggs, and the female frogs started to develop male sexual organs. So there was gender bending going on. And then he could even choose, depending on the exposure and on the amount of atrazine, he could play God and create the sexuality in the downstream generations. So he started to lecture about this at our estrogen conferences and in his work. And the atrazine industry attacked him, threatened his daughters. Berkeley wouldn't help him. It was a very, very scary time. And I've been wondering why the scientists aren't coming out and saying something, especially the people that I had the honor of working with. They were all truly amazing scientists. No one wants to come forth and say this because of what happened to Tyrone Hayes. He was literally persecuted by big chemical agribusiness. Well, then comes along Lou Gillet. So Lou Gillet was an embryologist at the University of Southern Florida, and he's married to this phenomenal anthropologist, Elizabeth. I can't say enough about this couple that have done a lot in their own careers to further our understanding of endocrine disruptors. But there was a polluted lake called Lake Apopka in southern Florida. And Lou and his group started noticing that male alligators were developing eggs and being feminized, and female alligators were growing penises and being masculinized. And he was able to prove this by going into the waters. He was real He-Man, real handsome, robust guy. They were just such a great couple. She's still alive. He is not. Everyone thinks he passed away with lymphoma from hanging out in the polluted waters of Lake Apopka. It was a loss to us, a loss that he passed early-ish on. And he dove into those waters. He would catch these alligators and tie them to surfboards and start doing exploratory surgeries where he was able to prove that there was gender bending going on. And the thought was it was because the waters were polluted. Now Lake Apopka is remediated, but he's died from lymphoma about 4 years ago. And they're really, I don't know, I actually reached out just recently to some of my other mentors at Tulane and asked were there follow-up science. Did the gender bending go back and revert to normal after the waters were cleaned up? And they didn't do that research yet. But Tyrone went and took frogs who were male but had become homosexual, and he then fed them and put them in a world where they were now exposed to no endocrine disruptors, and the amount of gender bending reduced greatly but didn't totally go away. But this body of huge research by respected scientists who have tenured positions at prestigious schools where they say chemicals in our environment, and America has more chemicals than any other country, they are playing a role in gender bending. But nobody is talking about this. Nobody is talking about this. It's absolutely crazy. And I think it's all because of the degree to which Tyrone, who's an amazing human being, he loves, though, to come in a black cape. It's Halloween time, and I always thought of him. I love the idea of vampires, and I always thought he looked a little bit like he came out of New Orleans. But anyway, none of the scientists have been saying anything about the role of gender bending in the trans explosion that we're seeing. And what if your child goes through all this change, all this surgery, all this money, all these medications? What if it was an offshoot of pollution versus their own true choice? It's extraordinary. And nobody is talking about this. So I'm so glad that you asked that question so we could chat about it. And what you want to do if you're going to have kids is learn how to reduce exposure to as many chemicals as you can in a country that doesn't want to reduce the exposure for us. Like, there's about 9,000 additives in American food, and the European Union has somewhere between 300 and 600. So the last third of my book, Hormone Deception, is a step-by-step how to reduce exposure in your home, your supermarket cart, your food, and it's all based in science, and it's done in a way that doesn't make you stressed out and crazy. If you just do one improvement a month or one improvement a week, you know, you can handle some of these changes because you can get much of this stuff out of you. And that's your goal. Get this out of you, then make love and make that baby. That gives you, there's no guarantees in life for anything, but that gives you a better chance to have a healthier child and a less stressed family. It is a sadness to me that none of the scientists are talking about this, but I can also understand it. But, you know, I don't have kids because that was one of the things of DES daughters. They couldn't have children. They were infertile. They had cancers. They had many other issues. Most of them died really young. So I'm more of a solo kind of person. So I have a bit more bravado to share this because I so want people to have healthier and healthier children. And it's multifactorial, but it comes down to reducing your exposure to chemicals. People who start eating organically really eat organically. They've done studies now. Within 3 days, chemicals just start to exit your body. And when they do blood level analysis of chemicals, within a week of going organic, many of these chemicals start coming out of your body. But they store in fat cells, so you have to keep up. Detoxing needs to be an ongoing mainstream thing that we do, that we have detox tools. And I even think that we should have insurance reimbursed detox centers before people get pregnant, but I don't know if that's going to happen. I mean, yeah. I doubt it, but that would be the ideal way.
It'll happen when the insurance companies start covering nutritional testing. Right. No, I love that you're brave enough to talk about the topic. To me, it's cowardice. If I'm a scientist and I'm finding something so alarming that it could alter the outcome of humanity. I mean,
yes.
Ultimately, what happens when men become women and women become men? I mean, you know, now we're talking about a crazy world where you don't know the difference. And I'm not, like anybody watching this, if you're homosexual or if you're transgender, this is not me saying you're wrong or that you've chosen a lifestyle that's immoral or unethical. This is just me as a scientist with a care for humanity, trying to understand better how do we prevent this from happening. Because if you're a child,
what's really causing this to happen?
If you're a child and you're gender confused, how does that affect your life? How much stress does that put you under? How much stress does that put your parents under? How much stress are you going to have to deal with as a result of some asshole corporation not being held accountable for poisoning your water, poisoning your food, poisoning whatever it is you're in, right? The milieu of chemical soup, because they wield strings of power and money. so that truth can't come out. And it takes bravery for truth to come out. I mean, we see this repetitively in our history. You know, nobody, not nobody, very few times in history do the masses come out and say this is wrong. Usually it's one person, like your friend, who was ostracized and demonized and criminalized.
Tyrone.
Yes. And then everybody else is like, well, let's all be quiet. But in reality, they can't do it to everyone. And if they just stick together, then the message can be overwhelming, and the truth can get out there, and then people can choose with their dollars, you know. Is it worth it to buy organic? Because you got this whole other argument on the other side. It's like, oh, it's not that regulated and it's not really worth the cost of buying organic. But as you've mentioned, the studies are pretty clear that when people start eating organic, the chemical levels start coming down and they're more protected. And obviously that's what we're after. We're after a healthy society. Because one of the other conundrums that I have seen is the mental health of society has declined just in my lifetime. I can remember even just 15 years ago, 20 years ago, you could have a conversation with somebody and you could have a disagreement, you could have a banter back and forth, and you could converse without offending, without, you know, sending that person into a tirade of violence.
We're reactive.
Yes.
Yes.
Yeah, and I think, you know, how do we come to some degree of sanity is we have to recognize what is the underlying course of what's driving all of this. And in my opinion, and I think in many other scientists' opinion, the chemical soup that we've allowed to occur in the United States, and not just the U.S., but predominantly here, has led to a massive poisoning and a massive endocrine disruption that contributes to a host of problems. So I'm thank you for being brave enough to just even talk about it, because I haven't found anyone else who really wants to talk about it publicly.
So I just talk to the ghost of my ovaries and I say, don't quiver, don't quiver. But look at it. So Vermont just passed a law. Vermont. I used to live in Vermont. I got some of my science courses done at Linden College in Vermont. I love Vermont, but Vermont just passed a law that kids could go get transgender surgeries without parental consensus or discussion, and they will keep separate files. And they'll have one file, a medical file that the parents have access to, and a second medical file that the parents don't have access to. And there's no discussion in that whole state about chemicals. It's really, really, and you know, so we finally last week had a federal judge that just said there is enough data, enough scientific data that fluoridated water lowers IQ in children, that we really should take action. Even though the American Dental Association says it reduces cavities, in every study where they compare cavity incidence in kids in other countries that weren't fluoridated to us shows the opposite. There's no difference in cavity incidence. But hormones don't work without iodine. So fluoride, and many of our non-organic flour and sodas have bromide added to them. They rinse iodine out of the body. Hormones will not work with iodine. You need iodine for IQ. You need iodine for hormone health. Our recommended daily allowance for iodine, we're all agreed upon 50, 60 years ago to the minimal amount that would avoid getting a goiter. Well, we've had a lot more chemicals in that last 50 years. So just fluoridation is, you know, there's 196 countries and only 24 countries use fluoride. The rest have rejected it because the science showed it was bad and it lowered IQ and caused cognitive issues, and it makes hormones not work. Fluoridated water is, I think, another link to the increased incidence of younger cancers, because hormones behave better when there's iodine on board and you're rinsing iodine off. JAMA, the Journal of the American Medical Association, came out about 2 months ago. I just wake up every morning and read the literature for 2 hours, and I've done this for over 50 years. And I write in a platform that's not censorable, because a lot of my older work got banned because I'm stepping out. And so I bumped into this article in JAMA, it's Journal of the American Medical Association. the pajama journal. JAMA. Alan Gaby used to call it the pajama journal. And they showed that if pregnant women drank fluoridated water, it rinsed iodine out of their urine. They measured the urine, and then they looked at cognition in the kids at 3 years old. The women who didn't drink filtered water had much more ADHD and kids with behavioral issues and lower IQ by 3 years old. But is your OBGYN telling you to use a water filter and to make sure that you go on iodine? There's not even enough iodine in most prenatal vitamins at all. So it's really hard to have a healthy child today in the United States. And I have to say, as well-intentioned as most people are when they go into whatever health school they go into, they're duped. And much of what we know and learn is all run by big agra and big pharma who want us to be consumers of medications from the womb to the tomb. And we have lost our way. And we got to start calling a spade and help our parents have better and healthier children and less stressful families. Once you have a sick kid, a kid that acts out, a kid that shoots, a kid that can't make it in school, it's a very stressful life for everybody. And how you eat and how you handle yourself before and during pregnancy has a tremendous influential role on this. And it's much less money to deal with this upfront, even though organic seems more expensive, than to deal with a lifelong ill child and a stressed out family.
Yeah, no doubt. I mean, I look at today, I would be mortified to want to start a family.
I know.
Because it's not, it should be easy, right? I go to the store, I should be able to buy real food. I shouldn't have to worry about chemical disruptors. I shouldn't even have to worry about the term organic versus conventional because, if it's done ethically well, you should be able to buy real food. You shouldn't have to worry about whether your drinking water is contaminated with fluoride and chloride and bromine as antiseptic agents to kill bacteria and then also kill your children slowly, right? So it just seems like there's a lot of stress on these potential upcoming new families. Maybe not even stress that they know about, but stress coming their way inadvertently because they don't know enough, because they've been poisoned, and they just don't understand it. And
or they ask their doctor who goes, "Oh, organic is not." Your doctor's not trained in this. They don't know.
Right.
Yeah.
Or they say, "Oh, those are alarmists. Those people are alarmists." And so then it's all kind of shoved under the rug and dismissed.
Or they're a chiropractor. What do they know?
What does a chiropractor know?
Please.
I always love that argument.
Yeah, we were the people really promoting nutrition when nobody else believed in nutrition.
Well, one of the only professions that didn't sell out to Rockefeller when he launched his mass poisoning of the U.S. through the systematized monopolization of medicine through oil. And all the chemicals we're being exposed to really are a direct descendant of his ideologies that competition is sin, and he wanted to own everything, and he kind of does at this point. But I think we're revolting. I think there's a revolution that's happening because people want to know more. And now, it's just my opinion. Social media.
I value your opinion. Plus, look at you. You're an in shape guy. Well, I want to hear good opinions from people who are walking their talk.
Well, you kind of have to, don't you? But.
What was that thought you just archived away? What was that?
Well, it was basically we have a society where doctors are technicians. The way they're being trained, the information is being purposefully siphoned out of the textbooks. I just talked with a pharmacist this week, Dr. Lafferty, she's naturopathic. She's got a doctorate in pharmacy. She teaches in medical schools. She's an academic, but she's also a clinician, a practitioner. And many of the doctors that she's speaking to, systematically, biochemistry has been removed from medical curricula. Now, biochemistry is foundational, as you know. I mean, it's the fundamental science of applied nutrition, right? I mean, that's really what it is.
I didn't know that. Biochemistry has been removed from
Yes. Not all schools, but she was talking to a med student, and they have taken biochemistry out of the curriculum. Some of the curriculum, they're removing you probably learned from the same Guyton textbook of physiology,
right?
Which is like, and for those of you that don't know, Guyton is like the end-all be-all of physiology textbooks. It's super thick and it's super, super deep.
You could do bicep curls with it.
Yeah, it's science. It's science.
Yeah.
But doctors should learn from that kind of textbook. Well, they've removed that now, and they're giving like Reader's Digest, like condensed versions of physiology. And if you're going into cardiology, you get the cardiology version. You don't get the fundamental physiological sciences anymore.
The cardiologists are the only genre of medicine that they haven't been able to pass their board certification exams for the last few years. And there's a lot of chit-chat among the medical field of what's going on with heart docs. They're not as smart. They're not the smartest docs in the tech anymore. And I just had dinner at David Brownstein's house over the 4th of July, and one of his best friends that he's known for years is a pancreatic liver surgeon. And he was saying, don't get Lindsey. You need surgery. Don't go to anyone who's younger than 50 because the training they get is totally different than the training I got. And their hands aren't really, and he went on, and both him and David said they would be glad to refer any patient to anyone they graduated with. Everybody was smart. So both his daughters, as I just said before, are now docs. So I said, well, how are the people in your residency? So Haley said, out of 10, she only had 10 people in her residency. She said, could only refer to 2. The other 8 weren't smart. So they make doctors not understand concepts, not know how to think, and be able to diagnose something, and then they pull up all the medications. It's all run by Big Pharma, and the curriculum is designed by Big Pharma. So it's really, this is the issue, and this is the medication for the issue. There's no thinking of root cause. How can we figure out how this, get you over this and only use the medicine for a short period of time? Why did this happen? How can we protect your kids? There isn't true agile thinking. There's only algorithmic prescriptive thinking to serve. And this, I think this happened because now most of the people who are politicians, ever since 2002, if their name is on a patent, which they all can have their names on patents, they make $175,000 per patent for perpetuity for all of their offspring, all of their kids, their grandkids. So the conflict of interest is huge, and we need to stop it.
Yeah, no doubt. I mean, it's destroyed what was once a great profession.
Right.
I think, anyway. I think we have to put thinking back into the schools, and you can't dumb down the curriculum and remove the complex classes because they're too hard. And I think it's done by design. That's my opinion, anyway, that, we want technicians because technicians sell drugs. And doctors think about their patients. They take them home at night with them, like literally in their brains, right? Thinking about what are we missing? What could we do differently? How could we help this person in a better way? There's thought. And I think a lot of that's going away with the corporatization of hospitals and hospitalists and, doctors that are graduating today. My son's a dentist, and, you're talking about fluoride. I asked him, when he was going through dental school, and this was just a few years ago, what are they teaching about fluoride? And his answer was, oh, it's fine. I said, so they're not teaching about fluoride as a neurotoxin or, the fluoridated toothpaste becoming a problem? I said, even with all the newer research, he says, no. He says they really just kind of glazed over it. So, I mean, this is the part of the problem, isn't it? It's that the curriculum, even in the doctorate level, graduate level school programs are glazing over things that are critically important. He also told me that they're still teaching that mercury and silver amalgams are fine.
No.
Like still. And I know a lot of dentists have switched over to non-silver based.
A,
yeah.
Right.
But now we're talking about
bisphenol
chemicals.
A is still an endocrine disruptor.
Yeah, so instead of filling 20 cavities, can we not have a conversation about why the cavities occurred in the first place? Anyway, to me, that's what they should be teaching in dental school, but they're just not. It's still not there, and I think we've got a long way to go.
Well, I don't know which way the camera angle is, but I'm missing a tooth over here, which I had a terrible, I just had to get this, yada, yada. I had to go see a surgeon, and I ended up meeting this surgeon about a week or two ago, and He was telling me he was shocked that there's no thinking in dentistry at all, and he's from Spain. And he has this beautiful accent from Spain, and he said in Spain they're still thinking, but it's starting to go away there too. And we got into this big discussion, and here I am seeing him as a patient, but he was able to figure out that, you know, I had a level of intelligence that we could have this chat about. And he started complaining to me how he felt like his profession was, you know, going to be able to not serve people except as technicians because there was no more thinking. And if you're a thinking person, you can't help but see this if you're in the middle of the health provider professions, which we adore, but patients don't realize this yet because there's phenomenal marketing from the American Medical Association, the American Dental Association, and we think if they put their brand on something, you know, it's like God coming down and making the crossover, whatever it is, but it's not necessarily true. And you have to start thinking for yourself, which is why conversations like this, and you can agree or disagree, whatever you want, it's great to be exposed to these chit-chats and then marinate on them when you take them in and see how you might make different decisions when things show up in your life and your kids' lives.
Yeah, no doubt about it. I was having the same conversation with another doctor where, you know, because it sounds a little bit daunting and overwhelming. Like, I didn't go to medical school. How am I supposed to know more than my doctor about what health is? Well, you already do. Anyone listening to this, you already know more than your doctor about health. Your doctor knows everything about which drugs to give you and how to diagnose your condition, but you already know more about health because they don't learn about health. They learn about how to medicate symptoms, and that's not the same thing. But the average person watching, I was having this conversation with their doctor, and her message of hope was, take your power back. Like, don't outsource the most important thing to you, which is your health, to a complete stranger who spends less than 5 minutes with you, and take everything they say as like the holy grail of what you need to be doing, because that person hasn't given any thought to you. They've just taken your cluster of symptoms, stamped it with an ICD-10 code, and said, here's the drug that matches that code. Go on and get out of my way so I can get on to patient number 62 today. And I don't know if you've ever seen, there's a movie by Mike Judge. He's the creator of Beavis and Butthead. So if you remember when MTV was brand new in I think it was the 80s, and they came out with this cartoon. And anyway, he made a movie called Idiocracy.
Which, I've heard about that.
In my opinion, is one of the, like, it's sad, but it's actually quite predictive. If you haven't seen it, I highly encourage that you watch it. It's good humor, but it's also probably too close to truth. But he you know, fast forward the world 1,000+ years into the future, and the doctors were relying on these or AI algorithmic machines to make all the decisions. And so it was like going into the hospital was like going into McDonald's, where you make your order and they have this big screen and you have a picture of fries and a picture of a soda. And so the person that's taking the order is like pushing the picture. So the patient comes in and he's like, I don't know what's wrong with me. So there's a picture of a little person that has question marks around its head. And so the doctor tech hits that button and then shoves them down the algorithm back into the hospital to meet with the doctors. But I feel like that's where we're going. Anyway, worth a watch. Yeah, definitely worth a watch.
Okay.
I want to go back to our conversation. We've had a really nice side conversation, but a couple of things you mentioned earlier. One was that we can agree, and that experts largely can agree, that the chemical soup that we're in is affecting people's health in tremendous ways. And you mentioned that detox should be an important part of what people should have top of mind, because we're not going to change the exposure. We can reduce our personal exposures by making different kinds of choices. I'd like to talk about what those choices are, like top shelf, take home ideas for people watching this. And then number two, maybe not top shelf or easy things, but what are detoxification strategies? Are there nutrients involved in detoxification pathways that people should know about? that are going to help them reduce the potential damage from the exposures that they can't control.
I'm so glad you circled back to detox, because it all comes down to detox. How do I get this stuff out of me, and how can I stay safer? I mean, that's what everyone should be hearing. So the planet is dirty, so how do I keep myself and my family safer? And detox, cleaning stuff out of you, because we get it in our air, food, and water. You know, if a building is being torn down a mile or two away from your home, the wind carries all the dust that has chemicals, metals, this and that in it, and you carry it in on the bottom of your shoes, and you bring it into your house. And Cornell did elegant research showing that just walking in a parking lot and then coming into your home with your shoes on, suddenly your pillows in your master bedroom are just covered with endocrine disrupting chemicals, and you wouldn't have thought about it. So how do we do this without going crazy? So one of the things I did was design 2 products, one called Receptor Detox, because hormones park into a satellite dish called a receptor. So you have to clear off that receptor for a hormone to be able to dock. So if you go get your hormones tested, and people debate about testing methods, it doesn't matter if your hormone level is perfect if it can't dock into the parking lot, and if the parking lot's dirty, so it's filled with endocrine disruptors that can't get in, or if you're not eating good food, or you're not digesting good food. You need nutrients for this whole interaction to take place, and the signals to go to the genes, as we started our conversation early on, that hormones deliver their signals to genes. So hormones need a lot of nutrients to do that. Hormones won't work without iodine, as we just mentioned, or vitamin A, or zinc, or B6, or magnesium. And these are all things that you get from a healthy diet, not from ultra-processed food and things that come in bags and boxes that have a lot of chemicals on the ingredient label. So detox is important. So because I worked at Tulane, and I got to hang out with these scientists who discovered these parking spaces. The very first parking spaces were discovered by Elwood Jensen and Yanaki Gustafson, and they all said the receptors got to be available. So I designed a product called Receptor Detox. You can take 1 twice a day, and it helps you just clear off the receptors. If you want to do a detox, a very simple detox, I have all the botanicals and nutrients in this product. If you take 4 twice a day on Saturday and Sunday, 1 weekend a month, with a lot of food in your stomach, because there's a little full flush of niacin, so it can make you a little teeny flushed for a bit. So don't get worried about that, but that goes away after you've used it for a while. You can get Receptor Detox. Just take 4 twice a day after a full meal, 1 Saturday and Sunday a month, and you get a detox just by using that one product. If you take that product, Receptor Detox, 1 twice a day, and you move through your world, like we're in a room and there's some outgassing from the building materials, a little bit from the rug, from the clothing that we're wearing, you know, it's ubiquitous. So you want something that's always clearing off your receptors, because your receptors are always getting clogged just by living in today's dirty world. And then I created a second product called Hormone Balance and Protect. And what it does is it keeps those cancer stem cells acting normally and not misbehaving. Remember the 2 theories of cancer, one cancer stem cells and the other one hormones driving it. And we know from Bruce Blumberg that we know that chemicals act on stem cells and make them nastier. So in my product, I put together botanicals that keep stem cells acting better for multiple cancer cell lines, and also keep your hormones even keel, and do many, many other things. So the products are meant to be taken together. Receptor Detox 1 twice a day. I should have brought some bottles of it actually. And Hormone Balance and Protect 2 at any meal, once a day, unless you have a health issue. If you have painful periods, you have painful nipples in your breast, you have excessive bleeding or pain with your menstruation, you have PCOS, then you would take Hormone Balance and Protect 2 twice a day, always with food, because niacin helps all of your hormones work better. There's a small amount of full flush niacin in both, so just remember you could have a little bit of flushing. The only contraindication is if you go into anaphylactic shock exposed to sulfur. But if you can take a sunscreen, which all have a little bit of PABA in it, then you can handle hormone balance and protect. But I made these products to make detox easy and to also keep those cancer stem cells, because there was so much data on how to keep cancer stem cells working better on multiple cell lines. So I translated that data and what I learned at Tulane by working with Elwood Jensen and Yanaki. By studying with them, they'd come there, give a lot of talks. We got to hang out with them. They gave private tutorials. So it was in. What's interesting is that Yanaki came from the Karolinska Institute in Sweden. So he's got a thick Swedish accent, and it's their version of Harvard. It's a very respectable institution. And he's been talking about the importance of botanicals to keep hormones safer. And he got wooed over here to Houston. He's in Houston right now teaching in one of the colleges and trying to make breast cancer medications that act to signal the estrogen receptor in a healthy manner. And because we have multiple estrogens, and one of them, that's too much for this talk, I think. When it signals estrogen, it's actually extremely protective. So he's right here in Houston right now, but he was one of the inspirations for these products. And you can get them online. On my website, drlindseyberkson.com, I have a pull down on the menu that says Dr. Berkson's products. I have a little video on them. You can get them at Full Script, at Whole Script. You can get them wherever they sell doctor's lines. You always want to get doctor's products because they're the ones that analyze what are in the products on a monthly basis. If you any doctor's company, you should be able to call them up and say, I want a fax of your most recent analysis of this lot, and they should be able to give it to you in 24 hours. I mean, that's what a doctor's line is. That's why you pay a little bit more, because you're not getting junk in doctor's lines. It's the lines that are not controlled in that manner, and that's what we mean by doctor's lines. So I made that product with one of the major producers of doctor's lines right here in Houston. So that's why the conference is here, because they're sponsoring it by Biotic Scientific Research. And they have 8 or 9 scientists, all PhDs, working on their facilities. And the FDA, often, if they have an issue, they'll reach out to Biotics and have their scientists help them out. And instead of binders in their products, they have whole farmland behind their facilities, and they raise these plants with probiotics and enriched nutrients, and they grind them up and use that for the binders, so you're getting just quality throughout the whole product. So that's what's in Receptor Detox and Hormone Balance and Protect, and years of learning about formulation, because Metagenics is a big company, and I designed their first fem line. I designed the first female line for physicians to use in the world in the early 1980s for Metagenics when they first opened. Susan Lark designed the first multi for women. Her office was around the corner of mine in Palo Alto when I had a brick and mortar office. And then I designed the Fem line, which was the first product for menopause, for painful breasts, for painful periods, anxiety, and things like that. And that was like 1982, 83. And so I've been working in that formulation field, and this is the next generation. So you can use that as a detox, but there's many ways to detox. And when you go to the gym and you sweat, just the act of sweating detoxes you. So there's many ways, and there's many mansions, as they say. There's many detox mansions in this world, and you can do all of them. We cannot detox enough because we're exposed 24/7. But you need to do something on a daily basis, because we're exposed to chemicals that can make our stem cells act much worse on a daily basis. So Receptor Detox and Hormone Balance and Protect are meant to be taken like one-a-days or multis for this issue of endocrine disruption.
Fantastic. So you mentioned those, but you also mentioned sweating. Any other simple things that,
Red light sauna is fabulous.
Red light sauna.
Even a few minutes a day or 10 minutes a day or several times a week, anything that gets you sweating and really you store these chemicals in your fat cells. So anything that makes these fat cells break open, but then you've got to make sure you drink enough water or you do some kind of detoxing thing to rinse it out of your body. So that's why a lot of water is always helpful. Skin brushing is helpful. Exercise is helpful to the point where you get, I always call it pink in the face Sundays, because every Sunday I formed a kayaking club in Austin, and we kayak every Sunday. We do 5 miles of a hard cardio run, and we're drenched. If you can get yourself drenched once or twice a week, that's huge detox mechanisms. But still we're exposed, moving into our world, just opening up that door, and then when you walk through your door back home at night, you're tracking in all kinds of stuff. So taking your shoes off at the front door like the Asians do doesn't track in a lot of the chemicals from outside into your home. Wiping your pet's paws, because bringing that. So where do we get most of our chemical exposure? Because that would give us an idea of how to detox. Like, where do we get most of this stuff? And the EPA did a 10-year study called the TEAM study. And in my book, Hormone Deception, I describe all of this. And they put monitors on almost 4,000 representative Americans for many years to see, and the monitors were sensitive to chemicals. So where did people get chemical exposure? Well, the bad news is it was in your home, and the good news is it was in your home, because you could do something about it. So most of your chemical exposure, actually, not all of it, but most of it is in your home. So if you take your shoes off at the door, if you have quality air filters, if you have a whole house filter or at least shower filters, most of the exposure is in the bathroom in the morning. You have a hot shower for 10 minutes, your pores open, there's chemicals coming out in the water. You could buy a $50 Berkey shower water filter, Berkey, and they have a picture, if you go to their website, of all the different shower filters and then which one you would need to buy to fit your shower, and you change it every 6 months. And this company hasn't raised their prices for 10 years. $49 for a shower filter that works great. But if you buy green personal care products, because the biggest exposure was in the bathroom, so the water was running with chemicals coming out of the shower, and then you use non-green personal care products in the bathroom, or most perfumes contain a plastic derivative called phthalates. So if you could clean up your personal care products, get a shower filter on your shower, you've already reduced your exposure to chemicals greatly. And then the other big deal is do not microwave in plastic. Plastics are estrogenic, and if you microwave food, even you buy health foods at Whole Foods and they come in that little tray, do not microwave it. Put it in something else, a ceramic dish or bowl, and microwave it in that. All of the research scientists that are in this field, one of the top things they don't do is microwave food in plastic and then sip it or drink it. And the other thing they don't do is, all these chemicals love fat. So the foods we live in inflationary times. It's really expensive to buy food now. So if you're wondering, which foods should I buy that are organic or not? Where should I put my money? So these chemicals love fat. So your fattest foods are the ones you want to get organic, because they'll store most of these chemicals. So that means dairy products, butter products, cheese products, meat products. Those are the highest foods in fat. Or seeds and nuts. If you're going to get cashews, almonds, it's better to get them organic, because they have a lot of fat in them. It's good fat, but they have a lot of fat, and these chemicals store in fat. And if you want to know which vegetables, and I buy all organic if I can, but if you want to know where to really spend your money, the Environmental Working Group, every year they come out with their dirtiest dozen. And that's the foods that are most sprayed with the chemicals that are most linked to cancers and other health issues like your children's IQ. And they always have a list of them. And it's usually the foods that are the most popular because farmers are trying to grow them the fastest. So for example, the last 2 years, green beans have been on the top, and they weren't there before because they're so popular now. Kale has become a very popular food, but you want to get organic kale because it's highly, highly sprayed. You can go to the Environmental Working Group, or EWG, and they come out with a list of the healthiest foods, the worst foods. They even have an app if you're wondering which personal care products have chemicals that are either carcinogens, or meaning they cause cancer, or endocrine disruptors, meaning they make your hormones that dictate everything not work well. They have an app that you can download, put on your phone, and all you have to do is just take a picture of whatever product you're looking at, and they'll give you an idea of how safe it is or not. So there's a lot of tools to help you do this without going insane, because once you start hearing this, it's a little overwhelming. But if you just make one change a week, or one change a month for somebody who can't, maybe you have 4 or 5 kids and you're starting a new job and you can only make one change a month. Slow change, one by one. 1 month, don't microwave plastic. The next month, try and buy as much in glass as you can. You don't want to have fruit juice in a plastic container, mayonnaise and ketchup in a plastic container. It's hard to find these, but they all leach into the food, especially fruit juice, which is so acidic. And here's your kid drinking fruit juice, and so much of it is plastic. So you want to try and, as much as you can, purchase liquids or foods in glass to try and protect your family. And the one other thing is your toothbrush. We now know that microplastics are in our sperm. We know that microplastics in our blood vessels cause stroke 4 times more than the highest level of cholesterol, because they make the blood vessels stiff, because they're like strong little, brittle little bits under 5 millimeters. That's what makes a microplastic. It's smaller than 5 millimeters. Well, your toothbrush is all filled with plastic bristles. And the thing to do is order boar, what do they call it? Boar hair brushes. I think it's boar hair brushes, and they don't cost very much money. They come in a little container, and you use it for a few weeks, and you go on to the next toothbrush. You usually get about 12 or 15 in a package, and it's pretty similar to the price of regular toothbrushes. That alone is a big step. Just decide, look at all the possible steps. Read my book, Hormone Deception. The last third is all about doing all these different steps, although I keep learning new steps. I just learned about this toothbrush deal. They came out with the understanding that microplastics were now polluting sperm, which is a big, big deal, and placenta. The average American woman's amniotic fluid, where the fetus is, just hanging out in, floating in, has 200 to 300 chemicals in it, influencing the fetus. So you really want to start trying to reduce exposure, because even all healthy Americans have it. So when I heard about this, I started thinking, well, where do we get most of our plastic exposure? And I thought, oh my God, toothbrushes. We're brushing our mouth with these little plastic bristles. And then I bumped into alternatives, which were the boar hair brushes. So and we're going to learn more and more things that we can do as we put more and more brain power into this. But one step at a time will do you. The shower filter, go get a shower filter. That is a huge step. One of your biggest exposures is standing under the shower, and your pores are opening from the hot water, so you're really drenching and sucking it up. Then taking your shoes off. These are very doable things. And asking guys that come in to do work in your kitchen or here and there to wear booties over their shoes, because you want a clean environment as much as you can.
Fantastic. Lots of great practical takeaways. Thank you.
And they make such a difference. Look at this. I had breast cancer 33 years ago, and I've been on hormones. And it was ER positive. It was like 95% ER positive, 90% PR positive. And no one checked HER2/neu then, but I knew about it because I read the literature every morning. So I spent $5,000 to check my own HER2/neu status, and I was positive. So that's like, I would be today, in today's world, I'd be getting a lot of chemicals to treat me. And then I also wanted to check my BRCA gene status, and no one did that back then. So I spent $6,000 on that, and then they felt like I had a cancer type that they'd never seen before in the United States. I was the first woman in the United States to have this breast cancer type. And they wanted to treat me like everybody else, and I thought, well, who knows if this kind of cancer should be treated like everybody else? So I actually, through much research, discovered that in the Netherlands, they'd already started getting this breast cancer histologic type. And there were 2 studies, one on 30 women and one on 60 women. And I went through much rigmarole to talk to the principal investigators on each of those studies and find out their thoughts on things and how they decided to treat those. I could go on and on from my experience of breast cancer forever. But nonetheless, I was ER positive, PR positive, HER2/neu positive, and I've been on hormones now for 30 years. And once I wrote Hormone Deception, I've cleaned up my whole life, my whole diet. I'd already done it to a great degree, but now I did a deeper dive because we all have to try and stay safer in an unsafe, predatory, polluted world. It's a group action, and you need to learn tidbits of health. But I have now, at almost 76 years of age, the best health I've ever had in my life. I now have the youth I could never really have when I was younger because of strategic, conscious living. And I take my own products. Before I took many bottles to add up my own products. Now I only have to take my own products, but it makes me feel safer because they tamp down those potentially cancer-inducing, nasty-acting cancer stem cells, which the chemical soup we're in instigates and riles those up. We all have stem cells, but they either act good or bad. I mean, everything's either this or that, and you want it to be more good than bad. So that's why I created that. So there's lots of things to do to help ourselves stay healthier in an unhealthy world and stay saner in an insane world. And conversations like this, so thank you for what you do, Peter. You're a hard worker. And this whole deal that you have, you know, a videographer, you invite guests, this is outside of what you're doing already in your practice for your patients. It's a lot of elbow grease. It's a lot to create this. So people should really eke out of it what they can, because this is gold. To be able to hear these things and get inspired, and it's up to you what you want to do with it, but this all makes a tremendous amount of physiologic sense. So I can't thank you enough for allowing me to come here and be a big mouth and share all my stuff.
Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this, and make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.